this is a solid treatment option. It's really just what's most appropriate for you, for your setting.
What do you think this means in terms of innovation in the allergy space?
We are in the halcyon era of fun and just exciting treatments in allergy immunology.
I never thought that I'd hear a professional in my lifetime say.
With Neffy, I really do feel like, wow, this is really just going to make it a lot easier for people to just say, I don't know what I should do. Let me just give this and I'll ask for forgiveness instead of asking for permission, but know that, gosh, this fixes everything.
Welcome back to EpiPod. Danielle's had anaphylactic food allergies her entire life.
And Sarah is a food allergy mom to 2 kiddos.
Managing this invisible health condition can feel so isolating.
Do you also feel like you have a degree in overthinking?
If you're nodding your head like me, then you're in good company.
Let's get you off that allergy island right now with people who get it.
Ready to dive in? Hey, Danielle.
Hey, Sarah.
I am so excited about today's episode because we finally get to talk to a professional about Neffy.
I feel like this has been a constant in the DMs, in our email inbox, and I mean, just personally, I've asked my own allergist several times, like, give me the nitty-gritty on this whole Neffy thing. I don't like new things as an allergy girly. So we really dive into the gray here.
Yes. And I mean, Dr. Nicole Chase is here. She is going to talk about Neffy, which if you don't know, if you're like, Neffy, what's Neffy? She's going to get into it. But basically, it's a nose spray epinephrine versus like jab yourself in the leg with an epinephrine auto-injector. So a lot of good in terms of like, it's not a big scary needle. And we talk a lot about that in this conversation too. But beyond that, I mean, we go through everything from cost to temperature to fear, to how, this could help in school situations or when caretakers are watching your kids. Danielle cries. It was a good episode.
Nothing new there.
But seriously, there's just so much hope to be had in this conversation. So we are really excited for you guys to listen in. But before we jump into the episode, let's tell you a little bit about Dr. Chase. She is a board certified doctor in allergy, immunology, and pediatrics. She specializes in the diagnosis and treatment of children and adults with food allergies and environmental allergies, asthma, eczema, and other allergic diseases.
She has been recognized by her peers as a top doctor in Minneapolis, St. Paul area since 2015, and she's currently a partner at St. Paul Allergy and Asthma.
So basically, she is just extremely qualified to talk about this and pretty much any other allergy situation, and I am so excited for you guys to listen in.
Let's jump in. Hi, Dr. Chase. Thanks so much for being here.
Hi, thanks for having me. It's such a pleasure to be with you ladies today.
We were saying right before we hit record that this is one of our most requested episodes probably in the last 6 months. Like when we ask people, or even when we don't ask people, listeners will write in and be like, can you get somebody from Neffy on the phone? And we're like, yeah, we're working on it. So thank you from all of our listeners too for being here.
Absolutely. It's my pleasure. I was saying also, I feel like there's a lot of gray area in allergy. And so you have to be cognizant that a lot of people are going to get different opinions from different allergists, but hopefully we can at least set the table today so that everybody has a basic level of knowledge and can, talk with their provider about what's best for them.
Well, let's start there. Can you give us a basic level of knowledge about what Neffy is? Like the very layman terms, what it does, how it relates or compares to other similar devices.
Okay, so let's start off. So Neffy is Neffy epinephrine nasal spray. It is an FDA-approved medication for treatment of allergic reactions. So really the idea is that the FDA was presented with this opportunity to consider a novel delivery device of epinephrine. For the longest time, we've only had epinephrine in an injectable form, either with a syringe or some type of auto-injector. And so Neffy basically is this idea that it's a small device. The device has been very well studied. It is a device that previously was used for numerous other medications. So there are some migraine medications that people take on demand in the nasal spray form. There are some anti-seizure medications, and there's also the drug Narcan that a lot of people maybe have become more familiar with over the years. And so it's the same device, the company that makes those medicines, they were able to formulate epinephrine with a kind of like an absorber, so that when epinephrine is sprayed into the nasal passages, it actually then is absorbed directly into the nasal mucosa, to the blood vessels that are there, and then goes into the bloodstream otherwise, just the same way that we think epinephrine otherwise goes into the bloodstream when it is administered through an intramuscular injection. And so basically, it was a lot of years that we've all been wondering and waiting and hoping for this to come out. And it was actually FDA approved in August of 2024 in the adult kind of, higher weight strength for patients who are 60 pounds and above. After the initial FDA approval, then basically they submitted to the FDA. This is the pharmaceutical company who makes Neffy ARS. They submitted to the FDA to basically have a 1 milligram device. So technically the guidelines are 30 kilos and above is Neffy 2 milligrams. And then we just recently heard about a month or so ago, maybe, that there's now a 1 milligram nasal spray that's been approved for more than 15 but less than 30 kilograms.
My first, as a lifelong severe peanut tree nut girl, my first inclination, I am the most nervous Nelly. I have been very open about my anxiety to our listeners. They know. So when something is novel or like new on the market, my first thing is always like, I don't know, we'll see how this works for other people first, Even making the switch from Zyrtec to Benadryl, sorry, other way around, doing Zyrtec instead of Benadryl, I was like, are you sure? Are you sure? To my allergist, and he was like, I'm very certain. Research shows blah, blah, blah. So you said the word, it's a long time in the making. Can you talk about how long this has been in the making exactly? Or like what, obviously the FDA knows what they're doing, but for somebody who has my mindset where they're like, I want to see how this works out for other families first, can you talk us through the hoops that you all have jumped through to make sure that this is safe and researched?
Yeah, I think that the one thing that I would tell you is that this medication has undergone extensive study by the FDA. Just for a quick anecdote, we all actually had thought that it was going to be FDA approved a year before it actually was. And the FDA said, you know what, we just want some more data. We want to be certain that if patients are having a reaction, and let's say they have nasal congestion or they're having other nasal symptoms, would the medicine still work? So I think that in of itself is really nice to know that this was not a quick approval. This took a lot of years. I don't know exactly when Neffy first started as like a concept in someone's brain, like, hey, we could do this. But I do know that the company that makes it had devised this kind of cool absorptive technology years ago, and they had been using it for other medications. When the FDA goes to actually approve medications, or let's say review medications, what they're focused on is, what is the safety of the medication, what's the efficacy, and then how does it compare to existing medications on the market? And as you well know, there are lots of epinephrine auto-injectors, there's syringe epinephrine that some people historically maybe has been prescribed, but what they looked at was they looked at two different components, one of which is called the pharmacodynamics, and one is called the pharmacokinetics. And so really one is like what the actual compound does in the body, but then the other is what does it do to the body's system? So what's the blood pressure? What's the heart rate? What's the response clinically? And what we know is that when those studies were done, the FDA deemed that this medication was not only comparable to all of the available prescription epinephrine auto-injectors, comparable to syringe epinephrine, but that actually it was able to have pharmacokinetic efficacy, so increasing like the systolic blood pressure, like what we're actually wanting your blood vessels to do to pump blood to your major organs like your heart, your brain, etc. That really that actually would occur within 1 minute of dosing, so that within a 5-minute period you would see effects on heart rate, effects on blood pressure, all the effects that we want to have epinephrine, do for patients, so that not only it fixes the problem, but also so people know when you take this, we want you to take it because it does fix everything. And we really want you to have the highest of high fidelity treatments available right in your pocket without having to delay administration, get to an emergency room, etc. I like to tell my patients that this medication has been approved by the FDA, and that is the gold standard across the world. And realistically, we know that the best thing we as allergists can do is not to make people afraid of epinephrine. We want to empower our patients to know that we trust you just as much as we trust our colleagues in the emergency room. And what we want is for you to have the ability to take this as soon as you realize that, hey, something's not right here, and for it to fix all the things that need to be fixed. So I think that, Danielle, I really appreciate that you don't want to be the first person out of the gates to try a new medication. I would say that in this type of situation that you absolutely can rely on the FDA's evaluation to say that this is a solid treatment option. It's really just what's most appropriate for you, for your setting. Obviously as an adult, the dosing range would be appropriate, etc. But realistically, we just want to make certain that whatever form of epinephrine you'll take, that's the one that I want you to have.
I have a question because, I have young kids who go to school and they're away from me, and I think to myself all the time about what happens if they have a reaction at school and their provider, we currently have AviQs, or not their provider, their teacher, their nurse, is hesitant to give it to them because they're like, oh my gosh, giving them a shot in the pulling the pants down, doing the shot, like that seems like a really big deal. So I love personally that Neffy it seems like less of a big deal, right? He takes like nose spray for environmental allergies and things every day and is used to that himself. And certainly I don't think a babysitter or anybody would be afraid to give it to him. My question though is there a certain way that you have to give the Neffy where you would still have to kind of educate the teacher or the nurse on exactly how to distribute the medication? Or is it just simply like a shh, you're done? That's I'll stop there. I have a couple follow-up questions, but that's my first question.
Okay, you're like me. I get into it and I'm like so excited to just kind of discuss all the things that usually I talk about. So I would say that, I feel for you, and I feel like as allergists, I always say the better you sleep at night, the better I sleep at night. And so I think about all those same things too. Like, what if someone goes to school? What if it's a new babysitter? What if it's a relative that you just, you kind of showed them, but you felt like maybe they weren't really listening entirely? I think that with Neffy, basically, it literally is plug and play. So the nice thing is that, number one, I think that with the current dose that's available, right, we're talking about kids that weigh above 30 kilos. So most of these kids are probably school age, probably otherwise going to be able to express some kind of, I'm having a reaction. And you might still have someone administering it, but they might be self-administering as well. I think that one of the nicest features of Neffy is that it just goes into the nose and you spray and it does what it needs to do from that point on. You literally are allowed to give Neffy in any position. So you could be laying down, sitting up, upside down. It doesn't matter. And I think that some part of that is due to the nozzle itself is going to deliver the medication into the nasal mucosa. And there's really just not a lot of ways that you can change that conformation, no matter what your acrobatic activities might be that you're doing. The other thing that made me think of, Sarah, was that, I really think that I feel like teachers, coaches, we really rely a lot on these people when we can't be there for our children, ourselves, our patients, etc. And I think that, to me, I really feel like, wow, Neffy now is something that I feel comfortable having my nurses teach the child. Hey, I know that you think about food allergy all the time. Even me as a doctor, I forget sometimes, or as a parent, you're doing a million things. I feel like that it's simple enough that we could even have children saying, you know what, actually, let me take my medicine myself because I know how to do it. I've practiced with it. I see how it goes in. I've listened to my nurse when I was at my visit. And I really think that it'll not only enable all those other people to administer it, but we might even be able to say, actually a person can self-administer this if they're developmentally able to do so. And I think that takes a lot of the scariness factor away for the patient as well. With little children, I think that obviously it'll be different with the new approval for the 1 milligram, but I just think that you're right that activation energy to give someone an injection just feels like you're hurting them to help them. And sometimes people can't get past that hurting them part. So with Neffy, I really do feel like, wow, this is really just going to make it a lot easier for people to just say, I don't know what I should do. Let me just give this and I'll ask for forgiveness instead of asking for permission, but know that, gosh, this fixes everything.
Yeah. My second question to that is there any issue if the kiddo has nasal congestion going on, like has a cold, and can the medicine still get through? Because that's a question I've heard from people even on my Instagram page saying like, well, in what scenario would Neffy not work?
So I would say that Neffy was that extra year that I had referenced earlier, where the FDA had wanted additional data. That's what that was about. The FDA said, look, we all have noses also. We've been stuffy at times. What if someone's having an allergic reaction and they get insanely stuffy? How can we reassure the American public that, we have done our due diligence and so we can sleep at night? And so basically they had asked ARS, the company that makes Neffy, to do a study with exactly that premise, inducing nasal congestion. So they had patients that they actually induced them to be stuffy. They administered Neffy otherwise, and the data looked great. So the FDA was satisfied with that. So I would say that they haven't done like a study of every combination and permutation. So if you have some kind of, I don't know, abnormal nasal anatomy or something, like you should talk with your own provider about whether this is right for you. But for the usual run of the mill, kids that have colds, kids that are stuffy during reactions, adults that have, just chronic sinusitis and maybe a little bit more inflamed, Neffy appears to be absolutely the same efficacy as in those patients as in patients whose noses are perfectly patent and not otherwise congested. So okay. It's really nice. Yeah.
Hold on. I have one more follow-up on the school train. Okay. So then the kid either gives themselves Neffy or they go to the nurse and the nurse is like, oh, this is easy peasy, and gives them Neffy. Are there any follow-up things that kid has to do? Do they have to go to the ER? Do they have to lay down? What kind of after steps are needed after they use Neffy?
Now it's time to hear from one of our sponsors, Larissa's Kitchen.
Get 20% off the only certified top 9 allergen-free meat snack at larissaskitchen.com. That's LORISSAS kitchen.com. Use promo code EpiPod.
Not only are they certified top 9 allergen-free by Menu Trinfo, they use 100% grass-fed and finished beef or free-range poultry, and they're zero sugar.
Larissa is an allergy mom that knows the struggles firsthand and founded Larissa's Kitchen to enable everyone to snack fearlessly.
Use promo code EpiPod to get 20% off your first order at larissaskitchen.com. LORISSAS kitchen.com.
Yeah, that's a really good point, because in all of our anaphylaxis plans, we know about this kind of like empty ventricle syndrome, where if you're not laying down after you administer epinephrine, at least intramuscularly, that there have been reports that maybe this could be an issue. So overall, with Neffy, there's nothing further that you need to do. Now, I would say that that's from a company perspective. From my perspective as an allergist, what I tell people is this. Based on the 2023 updated guidelines from the American Academy of Allergy, the American College of Allergy, these kind of joint task force guidelines, what we know is that there are certain situations where someone should administer epinephrine, but may not need to seek emergency care afterwards. And I think that those are very specific criteria. This is something that you should talk through with your provider, etc. But realistically, what I tell my patients is, you can't be having a catastrophic reaction for this to apply, and you can't be in the middle of nowhere. I'm in Minnesota, so sometimes people are kind of out and about. The Boundary Waters is beautiful, and people like to go on adventure. So if either of those apply, you really should be going into an emergency room afterwards, just because you're putting yourself maybe in a risky situation. But I tell patients, as long as you administer epinephrine as soon as you recognize that there is an allergic reaction, you have a backup dose. And Neffy comes in a 2-pack, so that would be consistent with kind of what we're used to for other auto-injectors. So you have a backup dose, but your symptoms completely resolve and you don't need to use the backup dose, and there's an adult that's with you, then I think based on the guidelines that some patients can choose to say, I'm going to take the epinephrine right away. I'm going to watch and see what happens. If everything is good and wow, like we're back to normal, then I'm going to call your office in the morning and say, you're never going to believe what happened. I need a refill, but like we did it and everything was okay. Because that's what we really want, is we want people to use epinephrine versus doing, diphenhydramine or doing medicines that are not appropriate and then waiting to see what happens. Just give the antidote for anaphylaxis, which to the best of our ability to tell right now is epinephrine. And as far as positioning or changes, there's nothing different that you need to do, but it is always important to have that backup dose just so then in case you need it, you're set, you're completely protected and have everything that you need on hand.
I have 2 questions. One regarding what you just said, and then another. When you say how, like, as long as you're okay, like, watch yourself, can you remind everyone what that means? Like, is that 2 hours? Is that with biphasic 8 hours? Like, my brain whirls as soon as there's a rule. I'm like, I need another one.
I know. And I think that really, it's hard because biphasic reactions, as we know them, typically, this is, I'm sure your listeners know, but this is the idea that you have an exposure, you have a response, and then even without having another exposure, basically the cells that are involved in allergic reactions, they have some things that are ready to go. They release them right away. So you get that initial reaction, but then they can make additional mediators that then get released later. So most biphasic reactions typically are within 12 hours. There's been like one isolated case report of one at 72 hours. I think most of us agree that, somehow the ERs have decided that 4 hours is their number. There's not great data on all of this, I'll be honest. But what we do know is that the administration of epinephrine is really the only thing that's been shown to decrease the risk of a biphasic reaction. And that administration, the data is better for the faster that you actually give it. So the sooner you give epinephrine to your initial reaction, that's what stops those mediators, those ones that are not preformed, that are synthesized. That's what stops those from being created. I think to what I said earlier, I always tell parents, especially, there's nothing that I'm going to tell you after your child has an allergic reaction that's going to actually make you feel good that night, right? Like you're just going to be on alert, and that's just real life. But I do think that most allergic reactions occur within the first hour after exposure. Some, like we know baked eggs, sometimes can be up to 2 hours. But after that, realistically, if you get out to 3 hours, 4 hours, 5 hours, 6 hours, and you're seeing nothing, I do think that you can feel comfortable saying, you know what, we treated this right away. We otherwise haven't noted any other symptoms. I think that we're probably in the clear. There's nothing that's going to be 100%, but I do think that once you get to that kind of 4, 5, 6 hour time point, that most people really do start to feel comfortable. And I think also that knowing that that data is there, that the sooner you give epinephrine, the better to help prevent the rest of this from happening. I really hope that that empowers people also with things like Neffy to say, we don't know, let's just treat, right? I mean, I think that back in, kind of old school medicine, people would come in with hives and we'd be like, let's just give you a shot of epi in the office. Or you had a bad asthma attack, and we'd say, well, just give you a shot. That's not current medicine. That's not what we do currently. But it's not that it doesn't work. It really is just adrenaline. It really is a safe molecule. I tell parents, it's a lot like just, like if you were just watching a scary movie and something really scary happened, you get that rush, but really then after that, it does get metabolized, it goes away. So I really think that for most people, it was the injection that scared them. I think that the medication itself is not scary. So I'm really excited that, things like Neffy are now available, and maybe we can retrain the allergists to help retrain the families and the patients to say, you don't have to take epinephrine, you get to take epinephrine.
I have been told that I maybe am not a candidate for Neffy. My allergist wanted to prescribe it to me. And in his office, he is King Neffy. Like, he loves it. He's used it in clinic. He's prescribing it left and right. And when he suggested that, because I actually had to get my prescription, it wasn't expired, my Auvi-Q was not expired. I accidentally left it in the car for like half a day when it was during a snowstorm. So he was like, you know what, it probably would work, but we're not taking any chances on that. Let's get you a new one. And he was like, how about Neffy? Because this wouldn't have happened with Neffy. And we can jump into temperature and sort of those guidelines in a second. But I was like, you know, when Neffy first came out, I was so excited because living in Austin, Texas, Sarah and I are like constantly fighting against the weather, whether it's a cold snap or usually it is just extreme heat. Feels like 119 outside for most of the summer. So you're like, how am I supposed to keep this thing? It's never going to be at the even like excursion limit. It's not going to be that until for 3 months. So it's really frustrating to constantly be carrying ice packs, but not let it get, you know, too close to our EpiPens. And so my allergist was like, let's get you with Neffy. And I was like, you know, I was reading on the website about who isn't a fit. And I had a full sinus rhinoplasty situation when I was, I think, 20 years old. I'm 33 now. It was in college. And I put it off for as long as possible. But I had a terrible nose break as a 7th grader. I read that polyps and rhinoplasty, maybe you're not a candidate for Neffy. Is that true? And my allergist again was like, you know what? It probably would still work, but let's keep you on Auvi-Q for now until like maybe there's a study about something like that. Can you dive into the details and the nitty-gritty on that?
Yeah, I mean, I think overall that the data that we have is that people that have nasal congestion, people that otherwise have not had any issues with their sinuses and with their nose are absolutely candidates for Neffy. I think that in every individual situation will have to be a case-by-case basis. Mm-hmm. My guess, though, is that since your rhinoplasty, you know, you've been more than 10 years out at this point, what we really are thinking about, what I think about is you need mucosa. You need that kind of like the inner lining of your cheek pink. You need that inside your sinuses. And so if there are areas where for some reason someone would not have normal mucosa, would not otherwise be able to absorb the epinephrine with that kind of adjuvant that helps it to be absorbed faster, that might be a reason. But my guess is that you probably would have your allergist be able to take a look in there. And I think if everything looks okay, I would say that I'm not your doctor, but I wouldn't be terribly worried about that. I think this is really like someone that's immediately post-operative or someone that's had some kind of just major otherwise issue. There's no data really on nasal polyps, but what we know is that for most patients, if they have polyps, they're in the sinus cavity. They're not in the nose. This is a nasal spray, not a sinus spray. So I do think that, you know, I've seen patients before where they literally have polyps hanging out of their nose. We might address that and talk about whether Neffy might be the most appropriate for them. But I think that if you have normal mucosa that could absorb it, I don't think that's what the FDA nor the company was thinking about when they said some people shouldn't use Neffy.
Okay, that makes me feel a lot more encouraged.
Absolutely. I would definitely revisit the issue and then kind of talk through. It's everything we do is shared decision making, risk benefit. I would say that if someone is completely averse to using an injector, a needle, and is never going to take it, I'd rather they have Neffy than nothing else otherwise. I think it's really the same idea of just let us know where you're at and we can meet you there. I do know that there are some patients that want to, you know, test the waters or have one nasal spray and have an auto-injector. I don't think that you need that. We still recommend that people always keep 2 devices with them. But if patients have switched over to using Neffy, I'm fine with them just having 2 of those otherwise then, just to kind of tail end to that conversation.
Danielle hinted at it, but let's talk about the temperature issue, because everything I've read said that it's a lot different than an epinephrine auto-injector. So what are the ranges in as far as what is safe for Neffy?
Yeah, so it's so fun that you say that, because I have the opposite problem here in Minnesota where people leave them in their cars overnight and then, you know, epinephrine will freeze. So basically what the company has said is that If the device itself is frozen solid, it's obviously not going to spray at all, so you wouldn't want to use it then. But if the device was frozen and then thaws completely, then it should be absolutely fine. So it can be used at that point. And then they've studied it even up to temperatures of like to 120 some degrees, 122 degrees, I think it is, for like, and I think really like limited excursions is what we're talking about. So we in Minnesota, like we are the mecca of Target, and so basically I tell parents, look, if you leave the bag in the car to run in to get your Target order and then come back out, obviously I think that would be absolutely fine. I think you wouldn't want to leave it in a car for like a full hot day. I haven't done the math lately on how hot cars can get inside, but I think there's lots of variables. But I do think that it's a lot nicer than the kind of what I used to say to patients, which is if you're comfortable, it's comfortable. So I think that knowing that it could be anywhere from just recently thawed up to 122 degrees is really a lot. It's a lot clearer of a temperature range. And I think that it'll hopefully prevent a lot of refills of people just being like, I just don't know. I can't risk this. It's, it's my safety or my child's safety.
What wouldn't I do for my kids? I love the story behind Abe's Muffins. The brand was founded by Abe's dad and uncle who wanted to make a brand of allergy-friendly snacks for their little Abe to enjoy with his friends. That was about 10 years ago. And today, Abe's Muffins is the #1 best-selling allergy-friendly brand in the bakery department. We love hearing about the amazing parents who take care of their little ones with allergies. It's, of course, a learning experience every day, but it's great to know that brands like Abe's help make snack time just a little easier for everyone.
Well, I mean, like in Austin, you go on one hike and you think, okay, it's 100 and something today. It's 102. And you go on the hike around the lake and you have your little ice pack, but not touching the EpiPens. And then someone's like, let's go to lunch and then let's go to this movie. And you're just like, it's too hot. Like I can't be outside with the EpiPen all day long. Like as an adult who, I don't have nap time and I do have the agency to get in my car. And I mean, there's a lot of times where I'm sitting out things just because I'm like, I need another ice pack for the EpiPen, or like, yeah, let's go, but let's stop at the grocery store. Like I'll get a bag of frozen peas or something. Like,
oh my gosh, sure.
Just constantly trying to like monitor myself and also monitor this life-saving device that I'm like, I feel like I'm babysitting a Tamagotchi. Like, hell, like I have to keep it alive or something. So,
I'm not gonna lie. So I'm so envious of you're like, oh, I'm going to go hike around the beach and then go to a movie and do whatever. I have young kids also, so I feel like that just doesn't happen anymore. But at the same time, I think you can really be, if you're able to tolerate temperatures that hot, up to 120 some degrees, otherwise you can have your Neffy on your person and you should be A-okay. Some people will ask, like, what if I'm out, skiing and it's very, very cold? Usually I tell people just put it inside your jacket pocket so that it's, sort of just within reach for starters, but also not going to just be literally completely frozen, because you do want it to be available to spray when you need it. But I think that this is really, I don't think humans do real well when it gets that hot. So I think this is really normal temperatures for where people are going to be, that they can literally just start throwing it in their bag or their purse or wherever else and just be like, it's good to go.
Wow.
Yeah, such a game changer.
Are you getting any pushback at all? Is there any group or board or college or or any allergist saying, hey, I'm just not comfortable yet, or I want to see it firsthand first? How are you getting allergists comfortable, and what pushback have you received, if any, so far?
Yeah, that's a good question. So I think that, as allergists, we maintain our certification. We take, tests regularly. We prove that our knowledge is up to date so that we're all doing, competent medicine for our patients. But really, it does come down to a personal decision with the provider and the patient as far as what they're going to prescribe. I don't know of anyone personally that's been like, oh no, I don't want to give this to my patients. I think that if anything, people are coming in saying like, oh, I just got a refill. Maybe I'll wait till I'm due again. Or, maybe I'll just try and get a prescription and see. From our organizations, what they really do for us is they provide us with the scientific data. And I think that the data that we've all seen so far really is supportive of not only recommending Neffy, but offering it to all patients, writing prescriptions for it, and really feeling comfortable that if this is what's used, that patients will actually be safe, they will tolerate it, and they will otherwise be treated appropriately per our national guidelines. So no, I haven't heard a lot of pushback. I do think that, insurance is always different regionally, and so there may be issues there, but I do think that I appreciate that the company has a copay program for commercially insured patients. And I tell families, sometimes maybe you want me to just send the prescription through and you can see, and then you decide otherwise as far as the cost. I also like to remind them that we've actually printed from the website, there's a Neffy specific action plan. And so I like to give patients that, not because I need to reinforce when they're going to use epinephrine, which I do always love to do, but because on the reverse of the form, actually, then it's just got instructions for how to administer, just in case the school nurse, coach, babysitter is like, oh, I listened to how you told me, but I just didn't listen exactly closely enough in this moment where I'm now panicking. It'll just remind people how to actually administer the medication. Little things like you can spray it and you don't need to sniff, for example, or if you're going to give a second dose, give it in the same nostril. Just little details like that I think sometimes you don't really focus on until you're actually in the situation itself.
I was going to ask about that, but are those the two main things, that you don't sniff after and it's the same nostril if needed for the second dose?
Yeah, the other thing, so I usually tell families about it, tell patients about it, like, okay, it's a nasal spray, it's needle free, it's very small, it has a higher range of temperatures where it's stable. You more or less can get a carrying case if you want to. You sign up on the website at neffy.com. If you feel comfortable giving them information, they'll send you it. The other thing I love to tell people, though, is from the manufacturer to the main specialty pharmacy that carries it, I think it's a pharmacy in Idaho, basically it's usually manufactured with about a 30-month expiration. So even if you think about the time it takes to get to that facility to the time that then you actually have it for, it really is typically 24 months or greater. So it's 2 years. Now, to me, I think I want you to use it. So I hate when people come in and they say, oh, I haven't used my Epi at all the past year. I'm thinking, oh, okay, that's fine. I'm glad you haven't had any accidental exposures, but I'm okay with you using it. But I do think that for some families, just thinking about that 2-year window, not having to switch during the middle of a school year or not having to otherwise, worry every single year about, oh, did we meet the deductible this year or whatever else. It's just convenience. So that's another point that I tell parents and families.
Yeah, that's fantastic. And then you touched on the cost. Obviously, it's different for everyone, just like an epinephrine auto-injector is. I mean, I know people who pay $0 and people who pay thousands of dollars. So is the range going to be similar with Neffy in that, is there a certain range that it's definitely going to be no more than this, or is it kind of runs the gamut, depends on insurance?
So what we're told by the company's representatives that call on us is that usually there is a program that if you have commercial insurance, that it would cost you anywhere between $25 to just under $200 for a box of 2. Now, I've had some families say that we don't want to spend $200. That's just outrageous. That's going to be a real burden on our family. We have multiple children that need this, etc. Absolutely fine. I have some families that say, I don't care how much it costs, I want it. And I think that some families actually do the math and they think, well, even if it is on the higher end, it's 2 years, so maybe then. I do think that there are always reasons to talk through with families about cost, but in the end, I tell everyone, as doctors, we're terrible about knowing how much things cost. So if you get to the pharmacy or you get the call and they say it's this amount of money, if it's ever something that you think is too much, you should say, you know what, hang on a sec, let me call my doctor's office back. Let us know, because there are ways that we can sometimes be helpful, either patient assistance programs, etc. But that's true for any medication. And I feel badly saying that we don't know, but we really just don't know. So you need to be our eyes and ears and telling us, hey, this is not good. There's nothing worse than having a family come back in and say, oh yeah, we spent $600 on an auto-injector, and me just thinking oh my gosh, you have to feed these growing children. How do you afford this also? So I think keeping us posted just to let us know how we can be helpful is important.
This is all so exciting. Thank you so much for taking the time to do this. I know, it feels so innovative to me the Neffy, I didn't even dream that we wouldn't have to carry a shot in our purse, for my son for the rest of his life when he was diagnosed. And then now to have this option just feels so freeing. What do you think this means in terms of innovation in the allergy space in the future? Like, what do you have hope for, even more or better or just easier options for families and people living like Danielle with allergies?
Oh, yes. I will tell you that we are in the halcyon era of fun and just exciting treatments in allergy immunology. One of the things I like to do is I like to stay really, really current as I can with new medications, companies that are looking into different things, people that are using medications maybe in ways that they weren't meant, and have done studies to find out new ways we can treat patients. I think that this is literally the tip of the iceberg. I think that we in food allergy, we know omalizumab now has an FDA approval. Hooray, finally, we all knew this would work. We're so glad the FDA has allowed it. Now we can use Neffy to really empower patients and to make it less scary and to really drive home that message. Danielle, as you said, like epi first, epi fast, right? Like just do it. You get to do it. But I think that some of the other things that are coming are just unbelievable. There is a researcher at Johns Hopkins who has studied a whole new class of medications and has used them in patients that are peanut allergic adults, and given them, this little pill twice a day for 2 days and then fed them 10 plus peanuts and they don't react. So there's this category of medications. There'll be something later this year probably for chronic hives if it gets FDA approved. And this will be our first foray into being able to actually see what these certain immune pathways, that if we block them, what happens. So yeah, you guys, this is the best time ever to have food allergies. Like, don't you worry. We have got your back, and we are really, really so excited to be able to work with you and partner with you, because this is not supposed to be a disease that takes up all your mind space. This is supposed to be something that you have to deal with, but at the same time, like, we really want to make people free from the stress of food allergy and just make it one more thing that's just a little small part of who you each are. So yes, lots to come. Very exciting.
I literally started crying because, just like this used to not take up very much brain space. And then I had because I didn't know. I didn't know that it was life-threatening. That my pediatrician didn't educate my family. And I had a really bad accident in my mid-20s. And it was a before and after event. Like, I'm working so hard with therapy, with a psychiatrist, with, just talking everything through with Sarah, with my allergist, like trying to get back to the person who I was before that happened. And it's what you just, it was the perfect definition that you just gave. It was a small part of who I was, not something that defined me, which is what it turned into. And I never thought that I'd hear a professional in my lifetime say, like, it's just felt like I can be as positive and turn it into lemonade and be an advocate in the space and blah, blah, blah. But at the end of the day, it feels like a curse. And it feels like something that's irreversible. Like, I tried OIT and it didn't work for me. I was too far gone with anxiety. Like, it ruined my mental health. So I didn't ever think that I would hear somebody use the words like peanut allergy me, adult me, like a pill that can block pathways. Like, who knows if that's going to be the thing or not, but the fact that they're actually providers and researchers working on actual allergic adults is, I'm just gonna have to sit with this for a couple of days. I didn't know that was happening, and it's so exciting to hear you say that, like, we're here for you, we got this, like, you as a profession as a whole, like,
yeah.
I just didn't think that this would be a thing for me. I always think, like, wow, if I have kids, or my friends who have started having kids, like, there's a lot of allergic kids that I know now, but I'm like, oh my gosh, like, how cool for Sarah's kids. But, like, what about the allergy adults? Or what about people who develop severe allergies as adults? I have a couple of friends who never had this until their 30s and they're like, how do I live with this? So it's just so encouraging to hear you say that. I've heard of like Neffy or like, oh, OIT's open for adults. And I'm like, no, it doesn't work for all of us. So thank you for sharing that.
Yeah, don't worry. Literally, Danielle, like everybody has their own story, but at the same time, like there's so much hope for the whole food allergy community. Like this is getting better. Every single day there is progress being made and you're not alone. And, just because one thing doesn't work for you doesn't mean that something else won't. So I think that you need to stay in your lane for now, but you stay posted with all the newest and greatest updates. I think it really will give you so much, so much encouragement to just know that we are working on this and there will be something for you. And I think it'll be soon, honestly. This has all just been such an amazing, the last 10 years, we've seen nothing like we've ever seen before in allergy. People have absolutely not forgotten about us and our patients. And I really think that there's only more good to come for you and Sarah, also for your family and for your children. Like, you guys hang in there. You are doing a good job. You are like doing such a great thing here with the podcast too. And I'm so grateful to have been a part of it with you today. Thank you so much.
Thank you so much. It's been amazing to have you on. And I know that you've helped a lot of people just better understand Neffy as an option and also just giving that hope to the food allergy community.
Yeah.
So thank you so much.
How good was that?
So good. And I just love that we end with that little punch of hope. There's so much punch in the gut as an allergy parent or as someone living with food allergies. And so to get like the opposite, that punch of hope just flowing through us is so amazing to hear in the allergy space. And I'm so grateful to have had her on.
I honestly don't let myself hope for much about allergies these days. Like, I stay positive, but I'm not hoping for it to be different because this is the way my body is and it always has been. So why would I have hope for it to ever be different? And this is the first time in a long time where I'm like, wow, I'm so excited to see what conversations we're having or what I'm safely eating in 5 years from now, 10 years from now. So that was just so epic. We're going to link everything that she talked about, whether it was a study. We'll also link the Neffy resources that she mentioned in the show notes. So be sure to take a look there. And as always, if you could hop onto Apple and Spotify to shoot us a review, that will help us get to more allergy families and get Dr. Chase and other specialists information that otherwise we didn't even know existed. So thanks so much for listening, and we'll see you next week.